Hello dear patients. Today we are going to review the patient who came to us complaining on rashes. He also had some chills. He went to dermatologist to his dermatovenerologic dispensary. He had a preliminary diagnosis of allergy. No analyses were taken. Anti-allergy medications were prescribed. He had been taking them for more than 10 days and there was no effect. On observation we see rashes, small spots that are localized on the skin of trunk, of the back and on the skin of feet area. These rashes didn't bother him at all. We presumed a diagnosis of syphilis, as these are its classic manifestations. We took comprehensive analysis for syphilis, where it was confirmed. So what it is? These are rashes that are described as spotty syphilitis or syphilitic roseola. This is the most common manifestation of secondary syphilis. It appears in the beginning of secondary syphilis stage, that is, when the spots develop after the patient leaves the primary period, when the ulcer develops on different areas, most commonly on genitals, which is a hard chancre. You can watch a separate video on our channel about what hard chancre is. This is when treponema pallidum spreads on the whole body. Usually the rashes of these spots are symmetrical on the skin of body and extremities. It is considered that hands, feet and facial skin are very rarely affected. However, in our case, feet were affected, and this makes such case a relatively rare one. Usually, in old manuals, the volume of such rashes was compared with a 10-15 copeck coin. If first days after appearance are described as bright red color, then later on it develops and evolves gradually into a so-called boring color, as Fournier, a famous syphilitologist, called it. This pale color remains during the whole course of roseolas. If we press by our finger or by a glass onto singular rash, then it would almost completely disappear, as it is due to vasodilatation. If roseola remains for a long time, then speckles from flowering of erythrocytes can sometimes remain due to their gradual breakup due to presence of hemosiderin in blood. Usually such spots do not fuse, as it was in our case, and they remain for 3-4 weeks on average. This patient also had enlarged lymph nodes. What reactions were positive in him at that particular moment? He had positive immunoglobulin M, immunoglobulin G. He had positive total antibodies that are the sum of M and G, and treponema pallidum hemagglutination test. Rapid plasma reagin test was negative, which indicates an early fresh manifestation. If common analyses were taken from this patient, if for example rapid plasma reagin test, a usual test for syphilis, was taken, it would have been negative. This may have indirectly told the doctor that this is most likely to be an allergy, and he is right. However, this is undoubtedly a syphilitic lesion of the skin. So, during such expanded manifestations on the skin, particularly the ones that are similar to this skin lesion, syphilis has to be always excluded, both by clinical observation method and by laboratory studies. If there are any skin rashes, including the ones that are suspicious for syphilis, you can consult dermatologists and venerologists of our paid medical center of dermatovenerologic dispensary in Moscow. We have experienced specialists to do diagnostics and treatment of such rashes. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.